Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ebola. The very word strikes fear into the hearts of many. This deadly virus, first discovered in 1976, causes a severe, often fatal illness in humans. Its origins trace back to the Ebola River in what is now the Democratic Republic of Congo. Ebola virus disease, or EVD, is a serious public health concern, particularly in regions of Africa. The virus has led to numerous outbreaks, each more devastating than the last. Ebola outbreaks can be devastating, leading to widespread fear and disruption in affected communities. The virus spreads through contact with infected bodily fluids, making it highly contagious. This includes blood, vomit, and feces, which can carry the virus and infect others. Even contact with contaminated surfaces can lead to infection, making hygiene and sanitation critical. The virus attacks the body rapidly, overwhelming the immune system. It weakens the immune system, leading to severe internal bleeding and organ failure, often resulting in death. The speed and severity of Ebola make it crucial to understand its signs, diagnosis, and prevention. Rapid response and early detection are key to controlling outbreaks. We must all be vigilant and proactive in our efforts to combat this virus. Knowledge is our first line of defense against this deadly threat. By staying informed and prepared, we can help prevent the spread of Ebola and protect our communities. Ebola is a scary disease, but knowing the signs can save lives. It's crucial to be aware of the symptoms and act quickly. It often starts like the flu, with symptoms that can be easily mistaken for less severe illnesses. You might feel feverish, with a headache and muscle pain. These early signs are common and can be misleading, but Ebola quickly gets worse. Severe weakness sets in, making it difficult to perform everyday tasks. You might experience stomach pain, vomiting, and diarrhea. These symptoms can escalate rapidly. These symptoms can be intense and dehydrating. It's important to stay hydrated and seek medical attention. A key warning sign is unexplained bleeding. This can be a critical indicator of the disease. This can be internal or show up as bruising, red eyes, or blood in vomit or stool. These signs should not be ignored. Unfortunately, by this stage, the disease is often advanced. Early detection is key to improving outcomes. If you've been in contact with someone with Ebola or traveled to an affected area, seek medical help immediately. Time is of the essence. Tell your doctor about your symptoms and potential exposure. Early communication can make a significant difference. Diagnosing Ebola quickly is critical for patient care and preventing further spread. Doctors use several methods to confirm the presence of the virus. Blood tests are essential. These tests can detect specific antibodies or genetic material of the Ebola virus. The sooner the test, the better, as early detection improves treatment success. Sometimes doctors collect samples of vomit or feces. These samples are analyzed in specialized laboratories to identify the virus. Testing needs to be done carefully to protect healthcare workers. Time is of the essence. The sooner Ebola is diagnosed, the sooner treatment can begin. It also allows health officials to track contacts and prevent a wider outbreak. Section 4. Combating Ebola, Treatment and Care. Treating Ebola is challenging, but there are options. There's no cure, but supportive care is crucial. This includes keeping patients hydrated and managing symptoms like fever and pain. New antiviral drugs show promise. These medications work by interfering with the virus's ability to replicate in the body. Early treatment is key for the best outcomes. Experimental therapies are also being explored. These include using antibodies from survivors to help fight the virus. While promising, more research is needed. The fight against Ebola is ongoing. Scientists and healthcare workers are working tirelessly to develop better treatments and vaccines to combat this deadly disease. Section 5. Prevention, your best defense against Ebola. Preventing Ebola is everyone's responsibility. It requires a collective effort from individuals, communities, and healthcare systems to effectively combat the spread of the virus. Simple measures can make a big difference. Regular hand washing is one of the most effective ways to prevent the transmission of Ebola. Frequent hand washing with soap and water is crucial. Make sure to scrub all parts of your hands, including under your nails, for at least 20 seconds. If soap and water aren't available, use an alcohol-based hand sanitizer. Ensure it contains at least 60% alcohol for maximum effectiveness. Avoid contact with bodily fluids. This includes blood, saliva, sweat, urine, feces, vomit, and semen, as they can all carry the virus. Wear gloves and protective clothing when caring for sick individuals. This protective gear acts as a barrier against the virus. This includes even touching bedding or clothing that may be contaminated. Practice safe burial practices to prevent further spread. Bodily fluids remain contagious after death. It's essential to handle the deceased with extreme caution. It's vital to follow strict procedures for handling and burying the deceased. Be aware when traveling to areas with known outbreaks. Avoid areas with known Ebola outbreaks. Stay informed about the latest travel advisories and health warnings. If travel is unavoidable, take extra precautions like avoiding contact with wild animals and practicing meticulous hygiene. Always stay vigilant and follow public health guidelines. UMCC, your ultimate medical consultant connectors.